Hello and welcome to today's panel on community impact. My name is Jessie Wiesblatt and I'm the Community Engagement and Events Associate here at Ovarian Cancer Canada. Within my role, I have had the privilege of working with and for the community to bring the Ovarian Cancer Canada Walk of Hope and meeting so many inspiring people engaged in furthering our mission. Of course, this takes every shape and form. Here joining me now are some folks who I'm honored to introduce you all to. First, we have Karen Bemister. Karen was diagnosed in 2019. Today, she's a patient partner in research, and she's sharing her lived experience and insights with researchers to guide decision-making as a part of Ovarian Cancer Canada's OVCAN research initiative. Karen, I wondered if you could just tell us a little bit about what it's like being a patient partner and working alongside the leading researchers in ovarian cancer research. Why are patient partners such a vital part of the decision-making process?
Well, being a patient partner is by far the most exciting thing that I've ever been a part of. Knowing that I could be a part of the development of a breakthrough treatment or early detection method is incredible. I've always had a fascination with science and mechanics, but never really wanted to make a career out of it. But I always wanted to look at things and how they work, and if they're broken, how I can fix it. And I guess I took the same approach with my cancer. I tried to find information, but what I found wasn't really good news. And unfortunately, the only find that I could see was a fix was the usual surgery, chemo, and the standard chemo. I'd already had my surgery when I was diagnosed. So when I got the diagnosis, I learned I wasn't eligible for any trials because my subtype of cancer was endometrioid. So there was no trials available for that. So all I could do was the chemo. And don't get me wrong, I was happy to receive the chemo, but I'm still looking at a 70% chance of reoccurrence in 5 years. So when I attended the Ovarian Cancer Canada Symposium last fall, I learned of the initiative, the OVCAN Patient Partners in Research, and that they were looking for people to join their team. I was so all over that. I don't even think the presentation was over, and I emailed Dr. Alicia Tone to ask her if I could be a part of the group. She said yes, so I was in. Since joining PPR, I learned so much about cancer and the mechanics, and most importantly, the amazing new research that's coming from the funding, some of which was directly from OVCAN. In some of our meetings, I've met and learned from some of the top researchers in ovarian cancer. I hear about all the new research. I'm learning from the doctors and their teams. And most importantly, I get to ask questions and possibly direct information about us, that may be beneficial from a patient perspective. Through the Patient Partners in Research program, I've just completed reviewing grant proposals for several new research initiatives. I was fixated on what was presented in the proposals, and I was so excited by the potential of some of the research. And I was proud that I was able to lend my voice and stand up for women like me, women like us, and tell researchers what we feel is important and how they can help us.
Thank you, Karen. And I'm sure I can speak on behalf of Dr. Tone, and she's so grateful that you did reach out and you are a part of that. And we're so thankful for your contributions. I just wondered if you might just share one or two of the kind of most important messages that you are bringing forward when you go to speak to those scientists and be a part of those panels.
Well, being in the scientific field, doctors and fellows, masters, undergrads, they all commit to a lifetime of education. So part of my job, I feel, as patient partner research is to educate them on what it is like to live with the disease. So a few months ago, I had the opportunity to tell my story, and it was similar to mine, to a group of young and upcoming research scientists. And let me tell you, talking to them was amazing. Previously, the ovarian cancer patients were a number on a chart. Then after they met me and my fellow PPIR team, they learned who their work was impacting. We put faces to a diagnosis. We gave voices to their research. Being at the table was incredibly amazing, being with these accomplished scientists. And it allows us to tell them that ovarian cancer is more than just a sample in a petri dish. We told them that there's been few advances in treatments and nothing in the detection of ovarian cancer. We told them how important getting an early diagnosis is and how easily it could be misdiagnosed as something else until it's too late and the cancer has progressed and metastasized. We are real life, real live, living, breathing people who want nothing more than to not ever think about our disease again. And telling them that is so much they could do to help this underserved area of cancer research. That was one of the proudest moments when they all thanked me for sharing my story, our story. And the most important message that I bring to scientists is hope. I hope for a cure. If I can't have a cure, I hope for an effective treatment. If I can't have an effective treatment, I hope for a good quality of life. But most importantly, I hope that one day, or that women one day will not have to face ovarian cancer diagnosis. I know that's not likely to happen in my lifetime, but I have hope.
Thank you, Karen. And that word hope, it's an emotional word for me. And I know it was a word that actually in the month of September in the lead up to the walk was used quite a lot in a lot of the conversations I was having. And I'm sure that you're, like you say, and you feel it, and it's so important to you, and your contributions and you going to that table and being a part of those conversations gives hope to so many others. So thank you so much for all that you're doing. We're so grateful.
Absolutely, my pleasure.
Thanks, Karen.
Thanks.
But of course, millions of those dollars in funding, they came following years of intense advocacy by Ovarian Cancer Canada and the community that we work for and that we work with. Kim Rudd is a former member of Parliament who helped bolster these efforts within the corridors of power. Kim, you yourself were diagnosed with ovarian cancer in 2020, and today you continue to support your Teal sisters living with ovarian cancer on the Of Dialogue platform, which is our online community for those who aren't aware. So Kim, I just wanted to start by saying thank you so much for your incredible support. And so many organizations appeal to the government for funding and funding support. But of course, not everyone is and can be successful. So I wondered if you could just tell us a little bit, in your own opinion, why Ovarian Cancer Canada was able to secure this historic investment.
Well, thank you, Jessie. And first of all, it's great to be here. I'm thrilled. I have, it's an opportunity to talk to folks who have questions, who don't understand this myriad of this world that we live in with ovarian cancer and the many facets it has. And fundraising and money and research probably is the most important one. So what was the reason ovarian cancer was so successful? I truly think it was the advocacy on the Hill. We're talking federal dollars here. You guys were relentless. You came every year, you found sponsors, you talked to people, you educated MPs. And as an MP, I mean, I learned things about things I had no idea about over my time. And ovarian cancer was something I knew about because my daughter's best friend had been diagnosed in her 20s. And so I did know something about it. And it turns out, I remember Donna Pepin came to the Hill and we were talking. It turns out we went to grade school together, we found out. And so ovarian cancer brought us together after, I won't tell you how many years, but it's a few. And the Lady Balls campaign was, I think, the hook, if you will. And it was a hook not because it's a fancy marketing tool, although it was. It's a hook because the majority of members of Parliament who are going to decide on this are men. And they don't really understand what ovarian cancer means. They understand breast cancer, but ovarian didn't understand. The Lady Balls campaign really gave them a visual that was discomforting, frankly, for a lot of people. And it wasn't just men. There were women who didn't really understand. And depending on your age and your family history and your experience with cancer, it's not something that you think about. And I'm a perfect example because I knew all those things. And I could still explain away all my symptoms. And so when I was diagnosed, I was like 75% of us with stage 3 and now stage 4. I'm platinum resistant, I found out, and I'm in my 3rd line, and I am in a clinical trial. I didn't qualify for the first one, but I wasn't stopping, and I did qualify for the second. And it's a huge commitment, but early reports are things are going better than they've ever gone, so I'm happy. And I'm also in the BioDiva study, which came of that ovarian cancer money. And Karen, I know you would know that because you were one of the folks around that table who said we need to have more information here, because each and every one of us, not just the 4 of us here, but across the country, we're all different. Our ovarian cancer is different. Our biological makeup is different. And that's why the research was so important. So because ovarian cancer, in my opinion, did such a good job with the Lady Balls campaign, when those of us who took this on went to speak to opposition members and senator, anyone we could speak to, they already had a pretty good sense of what we were talking about. So in April 2019, the $10 million was approved in the federal budget, and the rest, as they say, is history, because you guys have gone running with it.
Sure have. Thanks, Kim. And I think two words that you said stood out to me there, and that was relentless and education. And I think those 2 things were so crucial in that, but also are so important in all of the work that we do and the work of our community as well. So I'm glad that tied into that as well, and that was a crucial part of that. So I just wonder, while we have you here, would you have any advice that you might want to share that might help if we, or as we rally again for some more research dollars? Because as you said, we run with it, and that time will come.
It will come, and COVID's been very challenging for organizations to access government and be able to ask for very important funding. And I know that ovarian cancer went to all the provinces and got matching $1 million from some provinces, and they're not all on board. So I would say we keep pushing that. But the other thing I would say is that you've had success. There has been success. And that's something we need to talk about. And we need a campaign that says, this is what you helped us start. Look where we're going. And you know, the potential to where we'll be. Karen, you said it extremely well about what your hope is, that if we can't have a cure, those types of messages. So we can't give up. And yeah, we can't give up.
We can't, and we won't, that's for sure. Thank you, Kim. And I know you shared a little bit of your own story and your own experiences so far since your diagnosis, but I wanted to speak a little bit more on that personal level, and your involvement with Off Dialogue, which is, as I mentioned, Ovarian Cancer Canada's online community. Could you just tell us briefly what inspired you to join Off Dialogue, the online community, and how has that impacted your journey with this disease?
Well, a couple of things. One, I realized being able to talk to people like Donna, who has been through and is in this journey, really helped me sort of there was hope, to your point. There was hope. And every situation is different. And so we look for the hope in our own situation. And because I've been a public figure in my own community as well, it was COVID. It was a very challenging time for people. And people started reaching out to me and said, my mom has it. She's just been diagnosed. She doesn't know anyone. Would you chat with her? And so I did that a couple of times. And I found that sharing is healing for both of us, because we're giving that comfort and we're getting it back as well. And I joined the OVA Dialogue when I found out I became platinum resistant, because that was a whole new world, and I had a lot of things to learn. And for me, in my personal journey, it was really helpful and Kathy, who runs the OVA Dialogue, is amazing. And we could talk about, things like, well, it didn't work. They're thinking about putting me on KLX. Has anyone had any experience with that? And so so we talk about that. And then I talk them about the crazy life that is my life. And we'd all sort of share those moments of whether it was going to see our grandkids or whatever it would be. So it wasn't always about ovarian cancer. It was about personal lives and how we get strength from each other, knowing that, yes, we're going to go in for that CAT scan and we don't know what it's going to say. But in the meantime, we're not thinking about that. We're doing this. And so I found that very rewarding. And I also did an interview locally with a paper that got picked up fairly widely about ovarian cancer. And someone said to me, why would you tell people you have cancer? Why would you tell them? And I said, because it doesn't define me. It's something I have. Mm-hmm. And if I can help other women get a sense of what this could look like and be paying attention to it. And I'll be walking down by the water and somebody I know comes up, how did you know? What were your symptoms? And we need to have more of those conversations if we're going to get it caught earlier and earlier all the time. So I found OVA Dialogue an amazing resource. that gives me not just information and hope, but also a personal connection to other people's success and a compassion for other people going through some of what we've all gone through. So it's a great forum.
Yeah. Well, thanks, Kim. And I think really it's such a community, isn't it? And that support and that those relationships that you're able to build is so incredible, and I'm sure makes a difference for so many. And thank you, Kim, as well for starting those conversations and having those conversations, because it's so important, and we're grateful for everything you've done on both levels. So thanks for joining us here this evening, and thank you for
Happy to be
everything.
here.
I'm going to move on now to someone else who's taken that online realm by storm, and that is Charlotte. So Charlotte Cook-Dowsett was diagnosed in her early 30s and recently celebrated 5 years cancer-free, which is an incredible milestone. Yes. Charlotte, you use your social media to rally your community for events like the Walk, which took place in September and takes place every September, and just to amplify our cause. You have a very special, you're a very special kind of community champion by seizing every opportunity to inform people about ovarian cancer and the work of Ovarian Cancer Canada. So I just wondered if you could tell us a little bit, Charlotte, about what inspires you to take to social media and do that.
Well, what inspired me to start with is honestly that need for connection. Being such a young person diagnosed, which is not normal at that age, I felt very isolated, and it was before dialogue. It was 5 years ago, so I was lucky enough to see the birth of that communication, but it wasn't there yet. And Ovarian Cancer Canada reached out to me right away with By Your Side, and I felt so supported that way, and I loved that. But I felt like I was on an island. I had lots of friends who had battled breast cancer, and I had a friend battling leukemia, but I had nobody to talk about ovarian facts with, and no one else with the different, like I was trying to be a mom, and I got my diagnosis trying to be a mom. So I felt very much on an island, and I found Instagram actually is what connected me. I found Teal Sisterhood so far beyond, and then even beyond, I started to realize there were other connections within Canada and within Winnipeg. So it was that need for connection and that feeling of not feeling alone. But honestly, survivorship is what keeps me going, and loss inspires me as much as that's hard. We're talking about hope, and I have hope, but I also honor those that are gone, because I've been a survivor for 5 years, and that reflection is a big part of it. On my online community, half of us are here. That statistic of 44% is true. And even though we were young survivors, half are gone. My very good friend who I met through cancer yoga, Teresa, passed while I was battling, and she's in my heart all the time. And there were 6 of us that went to a paint night put on together by Ovarian Cancer Canada as a celebration of the Walk of Hope. And out of that group of 6, 3 have passed. So I feel like an incredibly lucky human to have been diagnosed at stage 1C, which is 15 to 20% of us only get that diagnosis, and only 44% of us get to live for 5 years. So I know I'm the exception and I am not the rule, and I am sick of being the exception and not the rule, and I am not going to stand for it anymore. I can't handle being so lucky catching at stage 1C when so many of us could if we know the signs and symptoms. So I feel like it's my rallying call, and it's my job, no matter if somebody really wants to listen to me or not. If someone is talking about symptoms or feelings, I start going off. I don't care where I am. It could be in person, it could be good friends, it's social media. I feel like there isn't enough being said about the signs and symptoms of ovarian cancer, and because it's a women's disease, it often got dismissed or not studied. So as much as I'm just one person, I'm a loud one, and I use my voice to shout about the signs and symptoms. I feel like I try and be positive as often as possible, but I also want to be real. So it's that balance of hope and positivity, and also that reflection. A good friend of mine who I went to high school with thought she had cervical cancer, and upon further inspection, because it wasn't diagnosed, they could diagnose cervical cancer. They found out it actually started in her ovaries, and now she's stage 4 terminal, and she's 36. So these are the people that I carry with me always, and that is what inspires me to campaign. But the Walk of Hope, women like Karen and Kim and Andrea, who you speak to, for all of us, this Teal Sisterhood, although we are small, we are mighty and we are strong. And it's that sense of community and connection that also keeps me going in those hard times.
Thank you, Charlotte. And wow, I think what you're saying there about having that hope and but also that honoring those and remembering and keeping them with you every step and with everything you do is so important, because you're right. You know, you as you say, you were lucky, but you don't want to be the lucky one. You want that to be the norm, that you're, it's not such a, the fact that you were caught so early is so lucky, really. So thank you for sharing that, and thank you for being loud and sharing those messages and using your voice. I know everyone does appreciate it. And I wondered if you could just talk a little bit about if anyone else, you know, one of the common themes that seems to be coming up again is community and connection, and you've used social media to do that, as well as ways to raise that awareness. But I wondered if you could maybe give a little bit of advice or have any tips for anyone else who's looking to maybe promote the cause, spread the word, or just maybe find that connection on social media.
I feel like the most important thing is to know the why behind your message. What are you trying to achieve? Who are you trying to connect with? Sometimes you may not know, and it's just a blanket call out. But if you understand, like, you're trying to find others who have gone through a similar situation, or advice, there's different avenues, different places to go to. I feel like Instagram and Facebook are really great, especially because, to be honest, we're most women who are diagnosed are an older market. We're Facebookers and we're Instagram users. I also do Twitter. I am learning TikTok. I understand I'm going to have to learn TikTok. It's not just like a time sucker in all the great ways, but dialogue as well, of course, through Ovarian Cancer Canada. Like there's so many mediums for us in this day and age. And I think COVID, as much as we found that isolation time, we also realized how united and connecting the world is as well, and how small the world is. So we are here for each other. And the Teal Sisterhood, as I said before, small but mighty. And if you want to find that connection, Ovarian Cancer Canada has an incredible presence, both on Facebook and on Instagram, and also on their own web platforms. So I feel like it's a great place to start, but don't stop there. Keep going, because that's the only way we're going to spread the message to people that don't know they have ovarian cancer, so they can find the signs and symptoms.
Perfect. Thanks, Charlotte. And I have to add, I think we're all still learning TikTok, really. I think we'll always be learning TikTok. It gets us through a lot of time, but what it's supposed to do, I don't think any of us really know. So I just quickly, I wanted to, I always talk about the walk being kind of the lead of the walk with Ovarian Cancer Canada, but I wondered if you could just tell us a little bit about your experience this past September. It was the second virtual walk, so we weren't able to come together as we hoped and have done in the past, but just that virtual element and connecting with the Teal Sisters and being a part of the walk in a virtual world.
Yeah, I got my mom on social media promoting her walk. She was up in Clear Lake with her group of lady friends. They were all in their teal outfits, all walking with community members that wouldn't have come to Winnipeg, which is where our Walk of Hope was. So it actually, although it was not organized in the same way, it was virtual, it actually allowed it for more participation. I had lots of family members throughout the province that were posting and promoting, and I decided this year I've joined a roller skating group, because apparently that's what you do when you're 39 years old and you haven't been on roller skates since the 80s. You bring it back. So I actually, instead of walked for hope, I roller skated for hope, and that community is a bunch of 20-somethings and 40-somethings. So every single one of those women were like, why are you wearing that shirt? What is happening? They all got the message. So I found it actually, as much as it was a new platform, it was one that worked out well, because, as I said, my mom, who's not very familiar with social media, to the young 20s who were posting because of it, I felt it actually helped grow the community, and I am appreciative of it. Although I still want to be walking in person with the Teal Sisters next year.
Well, I hope that next year you can combine the roller skating with an in-person walk and show everyone the skills, because that sounds incredible. Thank you so much. Thank you so much, Charlotte. Thank you for sharing and joining us this evening and being so open and honest with your story. We're so grateful to hear from you, and thank you. Just in the matter of time, I'm going to keep going, and I would love to open the floor up to Andrea Hatfield-Beaton. And Andrea, speaking of virtual events, you are representing an amazing committee of volunteers, and you're responsible for the awesome event that is the Lady Ball Halifax. The Lady Ball Halifax is a gala that raised funds in support of Ovarian Cancer Canada. So firstly, I just want to say, Andrea, on behalf to you and the whole committee, who unfortunately we couldn't have everyone join us here this evening, congratulations, because you were one of the recipients of the Peggy Truscott Award of Hope this year. This award celebrates outstanding commitment to furthering the mission of Ovarian Cancer Canada, and has your committee ever done that? I wonder if you could just tell us a little bit about the magic of the Lady Ball Halifax event. And as we find our way to the new normal, what is your vision for the future of events?
Well, thank you for awarding us the Peggy Truscott Award. We're thrilled. I mean, to get the recognition from our peers was amazing. So the Lady Ball Halifax is 2 words, it's magical, and it's very, very powerful. You know, we've got business women who are just rocking the runway out of their comfort zone, and they are owning that runway. In the last few years, we had some men that we brought on board, and they wore black t-shirts that said "Here for her," and they would actually escort the ladies, so we called them the male escort. So it was a fun evening. But again, very powerful, very impactful. And at the end of the night, we had the survivors come out, and they were escorted by a female RCMP officer in med-surg. The waterworks. And people want to donate. They want to help. So come to Halifax, September, hopefully, fingers crossed, for September 22.
Fingers are definitely crossed. Yes. We were chatting before, and I said, that's an event. I'm coming. I am coming. I suppose one of the special things about the Lady Ball Halifax is the special way that it does rally the community together. And sometimes people, when they're fundraising or organizing events, they do have a hard time reaching out to local businesses to ask for support. What has been a key to your success in this area? And do you have any kind of tips or tricks you could share with anyone?
Well, from day one, we've had our mayor, Mike Savage, who's been on board with us, and he's very vocal. He's been very supportive. He's walked the runway a couple of years. We had our premier at the time in 2019, Stephen McNeil. He was one of the male escorts. It really started with, you know, our regional director was going out and she was presenting to the businesses. You know, I think that when it was first called Listen to the Whispers, and then it became Knowledge is Power. So if you're presenting to, you know, a business group for women, and a lot of women don't know about ovarian cancer, they think it's detected with a pap test, and it's not. So, you know, they're listening to this presentation, learning, being educated, and saying, how can I get involved? What can I do? So it was an easy transition to the Walk of Hope, and then that just morphed. It was very organically into the Lady Ball. So, you know, we had large law firms, pharmaceutical companies that would purchase tickets to bring their female staff, their male staff, to come to the event. And just, I mean, we always had a silent auction. We've had, you know, spin the wheel, and people don't mind. They're quite happy to donate and just to help the cause. So I think with the business community, the women that you know walk the runway, you know, they're very influential. So it was just really word of mouth, and we very seldom got a no.
Mm-hmm.
You know, very transparent, and they could, when they came to the event, they could see where their money was going.
Yeah. And your event has just been so successful and just such incredible support. And I think, as you say, just being open and giving that information and talking and that transparency has been so important. Just in the interest of time, I do have to kind of keep us going. This has been such an incredible session, and you've all shared so much. But I did just want to say thank you all so much for joining here this evening and sharing your insights and your inspiration with us today. It has been so incredible to hear about how you're not only making a difference, but you're also seeing a difference as Ovarian Cancer Canada continues to press forward in improving outcomes for everyone that is affected by this disease. Our programs and our initiatives are only possible because of people like you, those who contribute their time, their energy, and of course their hard-earned dollars to advance this cause. So truly a giant thank you to all 4 of you for everything you do, and of course everyone who's joining us as well. We're so grateful. And of course I have to say as well, a big thanks to our generous sponsors that are making the Fall Symposium possible. I am sure that everyone is looking forward to connecting, as that's one of the best parts of events like these. The meet and greet sessions are coming up next, and we invite you to connect with other attendees from your region and beyond. Thank you for joining us here. Thank you for sharing and being so open and honest and transparent. And I think there's been some really important common themes that have come out, and hopefully some inspiration to share with everyone watching. So thank you all, and enjoy the rest of the symposium.